So the last part of my Knapp Sports Medicine assessment is going to be the spine, okay? And so just like in people, we have a cervical spine for dogs. Here's our little noggin right here. It works its way all the way down to here. So cervical spine would stop here to here. Our thoracic spine is going to start about here and go to here, right where the ribs lead off. And then we have our lower lumbar. And then we have what we call the LS region. People that get lower back pain, sciatica, that all starts down in this region as well. And they also have SI joints just like people, so we can kind of feel that area. So to manipulate the spine, there's a few things I'll do. I like to have them standing if at all possible. And then I just gently go ahead and I palpate. And what I'm doing is I'm taking these two fingers and I'm just gliding on each side of their spine. I'm just feeling the soft tissues, I'm gliding down. There should be no pain, no spasm, no trigger points. You shouldn't see one area of the body all of a sudden go into a little quiver. That should be normal. We get right down to the lower lumbar area and I just apply a little pressure. Sometimes I'll take my thumb, sometimes my fingers. You're not trying to manhandle, you're not cranking. It should not be painful. If all of a sudden there's pain, again, please stop, please make a note of it. And so this is what we call the lower lumbar region. And sciatica would be right back in through this region and follow down the back of our legs. So egret's spine feels absolutely beautiful. It glides nicely, everything kind of moves and feels like really, really nice function. The musculature is really good as well. The last thing, and this can be tricky, is the cervical spine. Now you and I, many people may have some restrictions or limitations. We always know I might have better range of motion to my left than I do my right. Again, your dog or your home companion may as well. So something that's important. How are you going to test that? We do this little trick called cookies to the hip, okay? And egret's very food motivated, so trust me, I think we'll be able to have this happen. But this is another great place to video it. Okay, what's the cervical range of motion like? So we're gonna have Dr. Deb go ahead and do a demonstration of how are we doing cookies to the side. Look at that. That's beautiful cervical range of motion, and then we go to the opposite side. So just like if there was a little, bug bite or a little flea or bee sting, all of a sudden they can turn. That's what we should be able to see. You don't want to take the head and forcefully go into a range of motion. They should easily be able to do it with the treat, okay? And so that's the last portion of our spine assessment. Okay, so hopefully this was helpful. This is part of what we call the Knapp Sports Medicine at-home assessment. Again, please feel free to play this video along as you're doing the evaluation. If you're not sure of things that you saw, please feel free to reach out to us. You can see the information below to come into VOSM, have it done in-house, gait analysis and evaluation.